Asthma is a chronic disease of the lungs. It can affect both children and adults. It can affect children as young as 6 months of age and older children as well. To understand asthma, it's important to understand how the lungs work in a healthy kid. So all of us have tubes, basically, or airways that go from our mouth down into our lungs. And they're wide open. They're easy for air to flow in and out, easy for us to breathe. In a child with asthma, those tubes or those airways are inflamed. So it becomes very difficult to breathe because it becomes very narrow, those tubes. So it's almost like breathing through a small straw. It is a severe disease, but it can be controlled easily. And children who have asthma that is well controlled can really function like normal kids. They can play, they can do sports, do gym. So there are really two main ways to control asthma. So the first way is to remove certain triggers that cause asthma attacks or asthma flares to happen. And the second way is to start the child on a daily controller medication. Triggers for asthma are what cause those asthma attacks to happen, those symptoms to happen. Triggers can be things like a cold or a virus. They can be allergen type things inside the house like dust, mold. They can be outside like trees, pets even. And other triggers can be irritants, and an example of that is like cigarette smoke. So first step is to remove any of those triggers from the child's environment. And once those are removed, if the child is still not well controlled with their asthma, then it's time to visit their primary doctor and start talking about a controller medication. So that's a medication they take every day, usually an inhaler, to help prevent those symptoms of asthma. These two medications here are also inhalers. They could be controller medications for asthma, which could be inhaled steroids. This back here is a spacer. So oftentimes kids use a spacer, especially younger kids, less than 6, because it's hard for them to inhale all the medication into their lungs. So what they would do is they would use this mask and make sure to get a good seal around their nose and mouth. And they would put whatever inhaler they're going to use, that could be their quick relief or their controller medication, so they would put that in there and they're ready to go. They would put this over their nose and mouth with a tight seal, and depending on what dose they were prescribed, they would push down their canister and take about 5 to 6 inhalations over about 30 seconds. And this long tube makes sure that all the medication goes right into their lungs instead of them potentially swallowing the medication or them not breathing it and then it going out over their shoulder, something like that. So a spacer is actually really key for asthma medications. Most people, when they think of asthma, that's what they think of. They think of an asthma attack or an asthma flare. And what happens is basically those airways, those tubes that are already inflamed, they get more inflamed and those symptoms worsen. And the symptoms that we're talking about with an asthma attack are coughing, especially coughing at night, waking up to cough at night, wheezing, which is kind of like that coarse, like almost a whistling sound. Chest pain even, chest tightness children can have, working hard to breathe. So you may see them using like their stomach muscles, using their chest muscles to breathe. So any of those symptoms are of an asthma attack. Some kids have all of them. Some children may only have one. And asthma attacks can vary in how severe they are. They can be managed at home with medication sometimes, but in a child who already doesn't have well-controlled asthma, that asthma attack can be even worse, and they may need to go to the emergency room. They may need to be even admitted to the hospital. A quick relief medication, an example of that would be an albuterol inhaler. So that's something that the child should use only as needed when they're coughing or when they're wheezing, when they feel like they are about to have an asthma attack or flare. If a child uses that medication a lot, very frequently, a couple times a week, that's probably a sign they're not well controlled, and they may need to start a controller medication. And so a controller medication is also an inhaler usually, and that's taken every day, often twice a day, and that prevents the asthma symptoms. So it's really important that that medication is taken every day. Even if the child's feeling well, this is what is going to prevent them from coming to the emergency room with an asthma attack.